Hi, I'm Andrea, your medical doctor,
And I'm Elysia, your dietitian.
and this is
The
the Peared
Peared
Podcast. So, this is a continuation of diabetes from our previous episode. There's a lot that we didn't cover, so
Yeah.
we're going to get into that, discuss a few more important points, and especially a focus on diet as well as some of the
Yeah.
medical management.
Because we really dropped the ball on that one.
There's
Nutrition.
There's just so much.
Yeah, there was a lot to talk about. And then afterwards, I was like, Andrea, we didn't speak about nutrition, the most important thing for diabetes.
Your unbiased or biased opinion?
Biased opinion.
Yeah.
Nutrition's the most important.
It is important. It is the cornerstone of diabetes management and should be the first step.
Literally the first step.
So let's talk about diet, Elysia.
What did we speak? Do you remember what we spoke about in the last?
We spoke a lot about fiber as well as about fiber, and maybe we can go a bit into the low GI foods.
Yeah. So we know fiber is really important in diabetes. It helps control blood sugar. And the low GI foods, high fiber foods are going to be your most important thing in diabetes. I think a lot of diabetic patients that I have think they need to like completely cut out carbs.
Okay.
In diabetes, but you need carbs. I think this is also
Yeah,
something we did speak about it.
You need carbs because carbs, it forms the energy for your body.
Exactly.
But it's how you get that energy. We don't want
Yes.
those dramatic spikes. We want slow, sustained release of energy.
Exactly. And that's what the high fiber foods are going to help with, which your high fiber foods are going to be like your brown rice, your quinoa, bulgur wheat, couscous, whole wheat couscous.
Whole wheat couscous. Yeah, I actually looked up on that.
Yeah.
I was like, couscous can actually shoot your sugar high if you're using, the white couscous. So, everything should be brown, whole wheat foods.
A lot of like brown bread, right?
Yeah.
Is higher in fiber than white bread, but it's not high in fiber.
In general.
In
comparison to other foods.
Yeah, so like your whole wheat bread, higher fiber bread.
Yeah.
And nowadays we also have low GI breads that are on
the market.
It literally says low GI.
Okay.
How
do you know something's low GI?
So there's a calculation that we do. So low GI, which is not on products right now. They have low GI foods written, but it's actually a calculation we need to do. And if the glycemic index is below 55, if I'm correct, I think it's 55.
Yes.
That's a low GI food. But on the for people, it's just normal, low GI foods. It would be marketed as low GI.
Okay.
Yes.
But also just to be aware that it's usually the less processed it is,
100%.
the lower GI it is. So if we're comparing other types of foods like lentils and your grains and those type of things will be unprocessed, so it will have more fiber, so naturally it will be lower in your GI.
Yeah.
Okay. Yeah. What is GI?
So GI is glycemic index, right? So that measures or tells us how fast that food is going to spike your blood glucose.
Okay, that
so
makes sense.
We want it to be a slow spike. You don't want to eat something and it's high spike. So that would be like your sugary foods.
Yes.
So pastries, pies, all of those things, sweets, that's a high GI food. So that's you're gonna eat it, and shortly after you've eaten it, your blood glucose is going to spike. Yeah, so that's what GI means.
Okay.
And that's why we want you to eat low GI foods.
Yes, especially if you're diabetic. It's so important because you don't want those spikes, because that's what's going to actually result in all of these complications. And it can actually, if you're eating foods that are just spiking your glucose levels all the time, you're never going to get that control.
Yeah.
So it's HbA1c, like we spoke about, that long-term control of your sugar spikes is what we want. We want to have a good control on that, less than 7, depending on which guidelines you're looking at, but 7 is the number that sticks in my head. That's what we should be aiming for most people. Obviously, there's a generalization. The older you get, sometimes we relax at HbA1c a bit because we don't want people to have too many hypoglycemias. But yes, essentially reduce the amount of short-term, everyday spikes of your glucose by eating low GI foods. And then
And high fiber foods.
And high fiber foods, yeah. So the high fiber foods go hand in hand. Do you sometimes recommend to patients to maybe eat fiber first, like before their meals, to try and, slow down those glucose spikes if they do have carbohydrates after having fiber?
So fiber and carbs is like, it's in. So what I recommend to my patients is always eating a high fiber carb.
Okay.
With each meal, if you're on different types of medication, with snacks as well, because certain types of meds, you're going to need snacks. But it's a good thing that you mentioned it, because when we eat other food groups with our carbs, it also helps
slow down that spike,
that glucose spike. So other things like protein is going to help. Slow release of that carb. So if you eat protein with your carb.
Yes.
That's why we recommend protein, carb, with all the food groups on your plate to help decrease
that spike.
Yes.
Okay. Because I've been trying to do this just because reading up on a few things and just to help myself in terms of, even though I'm not diabetic, I want to decrease the chances of becoming diabetic.
Yes.
So looking at my own glucose control, which will be reducing those processed carbohydrates, which is chips and all of the good things in life that we reach for, but then if you are going to have something that's high in or higher GI food, having like a salad or vegetables or something that has the fiber, to eat that first and then to have your snack following, so not on an empty stomach, to try and decrease that spike. So that could be a helpful trick, because let's face it, we have those days. So just bear in mind, like, let me just have some fiber first and then treat those treats as what it is, a dessert.
And also this we need to keep in mind with what you've said, we mustn't go overboard. We need to do it in moderation, not we said eat salad before your pastry.
Now everyone's gonna go and do
like, let me just eat this leaf quickly and have the full plate.
It shouldn't be an everyday thing.
It shouldn't be an everyday thing, and it shouldn't be the whole plate of dessert.
But if you are going to indulge, once a week or once every 2 weeks, and you're gonna have a slice of cake, try and have something prior so that you decrease that spike.
And then we decrease the other high GI foods that we have for that day. Like we can pick and choose. This is what I also tell my patients. Pick and choose. If we know we're going to an event, a birthday party, I know I'm going to have a slice of birthday cake. I'm not going to have all the other unhealthy foods.
Because
I'm not going to have the
overdoing
pastry.
it.
Exactly. We're going to overdo it, and we don't want to overdo it.
It's difficult to control yourself. But if what you're looking for is longevity and health, and those numbers matter, preventing the complications that we spoke about in the previous episode, if that's what you are interested in and that's what you actually need to know from this podcast, that's what you need to do. So it's giving the people the power to understand, life is flexible, be flexible with it, and try and adjust, but not overdo it.
Exactly. So we all can pick and choose. Do it wisely.
That's a good good one.
And
you spoke about the diabetic plate.
Oh yes. So going into from the carbs, I also wanted to say, with the carbs, we can eat carbs. All diabetic people need to eat carbs, but we need to choose the amount of carbs. We need to be mindful of how much carbs we're putting on the plate. So I think in one of our other videos we did the hand models, which we can use that still with diabetics, perfect. But the other thing is the diabetic plate. So that gives us a plate, and half of the plate is going to go to our vegetables. And then the other half of the plate we're going to split into quarters. So the 1/4 is going to be carbohydrates, and the other quarter is going to be protein. So if you're not using the hand models, then you can use that as well. And yeah, don't pile it up also.
Yeah, so it must be flat.
Flat, a good amount.
A one level story, not a double story.
Exactly. Perfect.
A 1-tier cake, not a 2-tier cake.
And also not like a giant plate.
Yes.
Like a normal dinner plate. Half of it vegetables.
And split the other half.
Protein and carbohydrates.
And then the carbohydrates, your low GI carbohydrates. That's what we need to focus on. And we will speak a bit more, in our shorts that we have on Instagram. We'll go a bit more into that, and on TikTok, we'll explain more about what is a low GI food, what it entails, what you can look out for, so that you have some practical tips.
And you also spoke about processed carbs.
Oh, yes.
And something I wanted to address in the previous episode was processed foods in general. Okay, so I said protein is going to help with glucose control, help with the carbohydrates to slow release the glucose as well. And I think we have so much processed proteins on the market, and it's convenient and it's cheaper than
unprocessed your piece of chicken or a piece of your steak.
Exactly. So, but it's so bad for us. So especially being a diabetic, we need to decrease the amount of processed foods that we have. Drastically.
Processed meats. We spoke about this before. But it's also
I think in the PCOS episode, I think we did.
But for processed meats in general, and I think that's what people don't understand, is that it's has so many so much salt and sodium in it, and that it's also resulting in people having high blood pressure, because we know that high sodium diets is a cause of high blood pressure. So looking at reducing that will also try and prevent, or at least manage. If you do have high blood, it will manage your blood pressure as well.
Exactly. And we know being a diabetic, you're at higher risk of getting the other comorbidities, the other chronic diseases of lifestyle, which is hypertension and high cholesterol. So decreasing those processed foods,
because it's also high in cholesterol.
Exactly.
And cholesterol, we have to think about the body as a whole, and not just your glucose levels. You have to also think about your cholesterol levels, because that is those things together, if it's uncontrolled and it's higher than it should be, is where we find people developing cardiovascular disease, increased risk for strokes and heart attacks, like we spoke about the complications in the previous episode. But also kidneys, we didn't speak about kidneys. I realized afterwards. I mean,
that's a risk factor, not a risk factor, sorry,
it's a complication.
It's a complication.
It's a complication.
My words today.
It's a complication of diabetes. It can be. And that's something that we do monitor through doing urine dipsticks and checking for any protein in the urine, so that we can make sure that we address any kidney disease as soon as possible. There's some medications that we can use to try and prevent the progression of chronic kidney disease. But important would be your glucose control, as well as your blood pressure control, as well as your cholesterol control. So those are the things that you need to focus on together. It's important. Doing
all of this is going to help prevent that.
Exactly.
Decreasing your processed foods.
Yes.
Increasing low GI, increasing low GI, increasing fiber, and decreasing saturated fats.
Yes.
Also,
which foods do you think of when you think of high saturated fats?
It's a difficult one.
But
protein.
Yes.
So animal fat.
Yeah.
So fats that come from your protein. I'm not saying we need to eat whole protein. So you need to eat the animal protein
for building blocks of your muscles.
Exactly, helping decrease. But we need to remove the fat. And I know. Fat adds flavor. And
but
the
maybe
skin
not
of the chicken adds flavor to that chicken. But remove that all before you cook it.
Okay. So that doesn't seep into the meat.
Exactly. When you're cooking a curry, a stew, all of those things, and you add the fat with the meat in. That fat renders off into the gravy into the sauce of the stew of the curry.
And that's why the sauce is so nice.
Exactly. And then we're eating it without knowing.
And you're thinking you're having, reduced fat by cutting off that piece of steak.
But you're not.
So you should actually fry it without.
So when you're cutting your meat for your stew, or you're prepping your meat for your stew, for your curry, for anything, remove all visible fat.
Can I tell you this? My mother actually does it. She pours boiling water over like stew meat,
Yes.
and she says the amount of fat that just like
Comes
slides off the meat, and
Literally.
the sink will be filled with fat. And then you just think about all of that fat that you consume, and then we wonder why we have so much like people with cholesterol issues. And yeah, so that's another trick. I mean, I don't know if fat can be melted with heat. So if you do it beforehand, like, in a just in a bowl, just like rinse it off with some boiling water, that can also decrease the fat
Exactly.
content.
And especially with stews, when you are slow cooking it,
Yes.
you could boil it before
Yeah.
to remove the fat, and then
Yes, exactly. And I mean, there's other forms of protein that isn't animal based.
yes,
Plant-based protein,
which is also really good for you.
really good soya products, lentils, fish. So now we're speaking more about the Mediterranean diet.
Yeah, we are.
I've done a lot of research on it, and I'm trying to find a diet that I can recommend to most people.
And that's a Mediterranean
And that's
diet.
the Mediterranean. It's the most studied diet. There's the most evidence on it, and I feel that it aligns with longevity for everyone and prevention of chronic diseases, which is what we are so passionate about. So, I mean, what is your take on the
Mediterranean diet? Really, I recommend to everyone.
Okay.
It becomes difficult with affordability,
Okay.
but there's ways around it. Honestly, there are. Mediterranean diet's so good for you because it has so much vitamins, minerals. It's low GI, it's high in fiber. So they concentrate, the Mediterranean diet as a whole, it concentrates on or focuses on whole foods.
Whole foods.
So unprocessed foods.
Exactly.
So,
which is what we're preaching.
Exactly.
Yeah.
So grains, vegetables, fruit, fresh, and it's also fresh, hey?
Fresh.
So your fresh fruits.
Your local produce.
Exactly.
Yes.
Local produce.
Yeah.
And protein that's lower in fat,
Yes.
as we said, unprocessed.
And I find that the Mediterranean diet focuses more on, the high fibers, having protein, but not making that the focus of the meal.
Yes.
So it's like not having red meat every day, maybe having it once or twice a week, maximum twice a week, and the other days focusing more on your white meat or your fish.
So your omega-3s.
Yes, oily, fatty fish, because that's going to, help with your cardiovascular health as well as your brain health.
Exactly.
So omega-3s, omega-6s are so important, and we can find it also in seeds, like chia seeds also has omega-3s.
Yes.
So we need to look at more grains, more fiber, more fish, more low GI foods.
Yes.
And that's what makes the Mediterranean diet.
And I know Mediterranean diet in everyone's heads. The first thing you think about is salmon. We know in South Africa salmon is so expensive. Oh my word, I went shopping the other day and I was like, I'm really feeling for salmon. When I saw the price of salmon,
it's crazy.
It was like four fillets. It was almost 400 rand for four like small fillets of salmon. This was yesterday, guys. Yesterday.
In this economy.
And we are like Mediterranean diet.
Yes,
fish,
but I mean, what other fish?
Other fish.
What
so
other fish?
mackerel, also really good, which you can get in a can on the shelf, and that's not expensive at all.
Exactly.
Pilchards, also high in omega-3s.
Love it.
There's also canned salmon. I don't know how you guys feel about canned salmon. Have you tasted canned salmon?
I haven't. I don't think I have. Canned tuna.
Yeah.
I know tuna's not as fatty.
No, it's not as
but
fatty.
I mean, it's a source of protein.
And it's a good fish as well.
Yes, exactly. So, but there's also, you can shop responsibly, like finding suppliers that, also farm, like fish farm responsibly, and then going to places where the fish is more affordable.
Yes, yes.
And I mean, even if you can't have the oily fish all the time, just knowing that you should be having it and trying to incorporate it like once every 2 weeks, if you can't afford it every week, is what you should be looking at for your omega-3s.
Yeah, but mackerel is also really good.
Yes, and mackerel's so nice.
And
it's very salty though. It depends how they prepare
process it.
So actually going for the fresh mackerel
Yeah.
would be the best.
Yeah. But I mean, the canned is also
Yeah.
good in brine, yeah.
Okay.
Yeah,
Okay,
but just
I
like
must look
rinse
at
it
that.
out that the
Before.
salt
Oh yes, you
content
were
comes
speaking
out.
about the brine and how that's
Yeah.
laden with salt, which
Yes,
isn't
which
also
is
good.
yeah.
So much to think about.
It is, hey. It's
Yeah.
a lot to speak about
Yes.
nutrition.
So
but
Mediterranean diet isn't really a diet like we know it.
no.
You know what I mean? It's not like restriction.
No.
So that's what I love
yeah.
about it. It's more about focusing and the addition of foods which have been shown to improve your health.
Yes.
So
yeah.
it's a different way. It's a way of eating. It's a way of lifestyle. It's not. It shouldn't be for a specific group of people. It should be for everyone.
For everyone. It's a life. I think diet we need to
rephrase it.
rephrase it, right?
Yeah.
The Mediterranean lifestyle.
Style,
Yeah.
Using olive oil is what they
Yes.
also prioritize, olives, which I love, and
I
just a
don't
lot
like
of
olives.
you don't like a lot of fresh produce.
Yeah. A lot of fresh.
Fresh.
Oh, what, Andrea? Me and my words today.
Yeah, it's been a long week. I think we just both tired. A lot of celebrations and cake.
I know.
So yeah, but okay, that was a lot to speak
Yeah,
about.
but you know what we didn't mention in the Mediterranean diet?
Yeah.
The grains. I did say grains,
yeah,
but that's also your beans.
yeah, beans.
Adding your beans in there.
Yeah,
high
which beans
fiber.
do you like?
I actually like a lot of beans.
Is it?
I like kidney beans. I like
Black beans.
black beans. I like chickpeas.
Oh, it's
I like
chickpeas beans.
yeah,
That's a good
it's
question.
part of the legume family.
Okay, legumes. Yeah.
Yeah.
Okay. Yeah, chickpeas.
Andrea.
I like hummus. Like I love making hummus.
Oh,
which
I
is
love
with
it
chickpeas.
also.
So that's also a nice way as a
Yeah.
snack. Some
Yeah.
hummus with some.
Oh, do you know what
cut
I
up
also
veggies.
make
What?
with the chickpeas?
What?
It's like a snack that you roast the chickpeas in the oven.
Oh.
I learned it from my lecturer in like second year.
Yes.
Yeah, you roast it in the oven with some olive oil and some paprika, whatever flavor spice you want.
Yeah.
Roast it and then it's like snacking on nuts.
Oh wow, I must try
It's
that.
so good.
Is it?
Then you don't like have your nuts, but you're having a high
You know
fiber
what it
snack.
reminds me of? Those corn. In the package you get like the hard.
Oh, no, but it's not like
That's
that.
not- that's not-
It's
not healthy.
roasted, crunchy on the outside, but soft on the inside.
Oh,
It's so
okay.
good.
I must
yeah.
try it.
Try
Another
it, yeah.
thing in terms of snacks for diabetics, popcorn.
Oh my word, yes,
Popcorn. It's like, but not laden with butter and salt.
yes.
Just
homemade
popcorn in the pot, a little bit of olive oil, heat it up, put the popcorn in, let it pop, and you have a good low GI snack.
And just
A little bit
some
of salt,
not like
pouring it. Yeah, it's so much better than the microwave popcorn.
Yeah, I agree.
Yeah,
I
so just
love
keep it
homemade
basic.
popcorn.
Keep it basic because we all need snacks, and these
Yeah.
are good snack advice.
Exactly.
Good snack tips.
Exactly. So we spoke about
Yeah.
legumes.
And then medication basics.
Yes.
Just not to go into too much detail because everyone is different. Your doctor will manage you. The doctor will know how to titrate your medication if they need to escalate it to more treatment. But generally for type 2 diabetics, we would start with metformin.
Yeah.
But first, actually the first step is lifestyle modification.
Yes.
If that doesn't work, then we're supposed to start with metformin.
Yes.
Not everyone does it that way because
It's like a quick fix kind of thing. We need to get the glucose down.
under control.
Yeah.
And we don't always have time, or the HbA1c is so high.
Exactly.
We're not going to win just with
Exactly.
lifestyle. But
And
we
I think
should be
also-
emphasizing lifestyle more.
A lot of people are not willing to change a lot of their diet.
Yes,
Yeah.
it's that cycle, that behavior change cycle that is challenging to address with
Yeah.
most patients if they're not ready.
Yeah. So then you go to
Metformin, and then looking at the HbA1c, usually initially we will test it every 3 months, and if we need to increase the metformin, we will do that to a certain point, and then an addition of other oral medications if needed. But long-term control of diabetes is difficult because your pancreas creates insulin, and sometimes you can have the pancreas that burns out. Maybe we failed with treatment and lifestyle, or just long-term control was just not enough, and that's also like a complication in a way, a progression of disease. where they now no longer now producing insulin, or maybe not enough. So then we might need to introduce insulin, and that is quite complicated and a challenge for most patients, because trying to get that sweet spot with their sugar control, their glucose control, their insulin intake, what they are eating, it's like a seesaw. Because you don't want to have lows, you don't want to have highs. It has to be that perfect in between, and it's very difficult. It's very challenging.
It is, because with the insulin, you also need to eat a certain amount of carbs based off how much insulin you're getting in, especially for people who don't produce insulin.
Yes.
You know,
the type 1s.
Type 1s and also type 2, where it's
it's at the end of the
where you have to get insulin, so it's like injecting yourself with something. Now you can't overeat your carbs or sugars, because the insulin, it's the amount of balance, insulin, exactly,
because you need the carbs, but you can't overeat carbs,
because you're only getting a certain amount of insulin to absorb that sugar, to take in that sugar.
So then monitoring your carbohydrates becomes very important, with insulin. I mean, and you get different types of insulin, which also becomes a bit confusing for patients. We're not going to go into that today because we don't have the time, and it is a bit complicated. But it is important to know the medication that you are on. It's important to know how to eat with your medication, and that you have to have that discussion with your doctor. So that's
dietitian.
Very important. So then I was we have a few more minutes to discuss a few last tips. There's been a lot of talk about how to, in conjunction, this is important, in conjunction with your medication, how can you implement certain foods or certain things to try and decrease those sugar spikes. And there's a lot of people on social media who recommend things, and it gets confusing, I understand. So I did a little bit of digging to see what research is out there. And let's just say this up front, we don't have enough evidence, but there are some studies which can suggest some helpful tips and tricks to decrease those sugar spikes. But the numbers included in these studies are small, which is important for us to understand, that it's not large-scale studies. We can't be 100% certain when we make these recommendations. So just for everyone to know, it's just random advice that we've heard and now investigated a little bit more. But one thing that they've seen in a few studies is taking some vinegar.
Okay, I actually saw this on social media.
Yes.
On TikTok, I think it was, a lady said if you dilute vinegar with water
and then
drink it before, was it 15 to 20 minutes before, then it helps slow release your carbs that you're going to eat.
Exactly. So and it decreases your gastric emptying. So that whole digestion of, or the release of your food from your stomach into your intestine where your food gets absorbed, that is a bit delayed and slowed. So then it helps. It's like traffic. It's like slowing it down so that you don't have
like a buffer. Kind of
that buffer.
Okay. So you read some studies on that.
So they some of the studies support this. And important to know, just going back to, it's usually a tablespoon, can be any type of table vinegar. I use apple cider vinegar, but you can
I actually read that apple cider would be a bit more beneficial.
Okay, I didn't see that.
But I think for this we have to see what more studies come out, more evidence that
before we can formally recommend it. Yes. So if you do use the vinegar and you monitoring your glucose and you see that it's helping, especially before big meals, 10 to 15 minutes, sometimes 20 minutes before, just to help decrease that gastric emptying and the glucose spikes. They say usually before your biggest meal that you're going to eat in the day. So not to overdo it, not before every meal, because you must also remember vinegar is very acidic. For the teeth. So drink it through a straw and try not to have goggle your mouth with it, because we don't want your teeth to now become damaged from this. So it's just something to keep in the back of your mind. Hopefully we'll have more studies that support it. But yeah, that was one thing that I found very interesting. And another thing was flax seeds.
Flax seeds, so good for you.
Flax seeds, yeah.
High in fiber.
High in fiber and just amazing overall. Actually shown to reduce and help with the control of your cholesterol, your bad cholesterol. So incorporating some flax seeds into your diet, sometimes ground like flax seeds are better for absorption of the nutrients.
So in a smoothie, I always add to my
some flax seeds.
smoothies.
Okay.
That would be perfect. Your breakfast as well. Also, just roasting it if you're gonna do snacks as well,
Even like if you're making like a muesli at home, muesli.
or
But
like breakfast
yeah.
bars or something.
yeah, another thing that they found in the study was that it can actually lower your HbA1c.
Oh, that's amazing.
So flax seeds is a good and easy addition to your diet.
And we spoke about HbA1c in our previous.
Yes, we did.
Oh, in our first diabetes episode. So
yes.
that's perfect.
Yeah.
Flax seeds. Yeah, I would recommend
It
flax
will really
seeds.
help.
Yeah.
And then the Mediterranean diet we spoke about.
Yeah.
Another article that I read was they looked at how just following the normal Mediterranean diet, but then looking at low GI versus high GI within the Mediterranean diet. So in summary, women were more affected if they had higher GI foods with Mediterranean diet. Their glucose control was not as good as those who had lower GI foods. So women seem to be a bit more sensitive to higher GI foods compared to men. So to keep that in mind, when you're having a Mediterranean diet, which we are recommending, that's what the science is supporting, keeping it low GI.
Low GI, yeah. And so the other thing with the low GI is fruits. There's certain fruits that are high GI. I know the stigma around fruits, especially with diabetics, is like, don't eat fruits. It's high in sugar, all of those things. Fruits have their own sugar, fructose. So there are lower GI fruits and higher GI fruits. So your lower GI fruits would be things like your berries, apple, your high fiber fruits, apple, berries. There's a list, figs, also low GI. So these are the low GI that we can incorporate into the Mediterranean diet.
Yes, and you should be, because you need the minerals that are included in fruit. Vitamin C especially. I mean, we need vitamin C. Don't want scurvy.
You need a lot.
Not so diabetic. It's important for overall cell health and the metabolism within the cells. So don't have, if you're going to cut out something, cut out the fruit juice.
Yeah, because that's got a lot of added sugar into the fruit juice.
It's not even pure fruit.
Yeah.
Like it's with, like you'll see like a 2%.
Exactly.
It's like, then what's the rest?
Also, certain canned fruits that are in syrup
is bad.
Guys.
I mean, come on.
It's in
sugar.
But frozen fruits are good.
Frozen berries.
Berries, yeah.
I go to this farm. I'm giving a little shout out because I feel like berries are so expensive in the shops.
They are, yeah. Yeah, they are.
It's so expensive.
What is like 50 rand for like a small punnet?
No, not even a kg, 500 grams.
Or less than, it's like 100, is it not like 100 grams
so,
of blueberries,
it's
like 50 rand?
I mean, who can buy that every week? It's in this economy, it's not going to happen. So I'll give a little shout out to Hillcrest Berry Farm.
Oh, okay. I actually buy the Hillcrest berries.
Yeah, so they sell it in the shop in a small box.
Yeah.
But if you go to the farm, they sell the frozen berries there. 1 kg of blueberries is like 80, 90 rand. And then you just freeze it.
And you freeze it.
And you have that in your smoothies with some flax seeds.
That's amazing. That's a good tip.
No added sugar. Don't add the sugar to the smoothies. And you can always maybe include like a sugar-free protein shake into your smoothie to help, reduce the sugar spikes from whatever sugar is in there, naturally occurring sugar from the fruits. Okay. So yeah, that's
a good tip.
Yes, and a good resource. So so we have, the time goes by and there's so much more we can speak about. But I think we covered most of the things that we wanted to speak about.
Yes. GI foods, all of those
Yes.
things. Mediterranean diet, no processed foods, decrease saturated fats. I think we did a
covered
good
it.
yeah.
Using diet with your medication,
yeah.
not separately. You can't do one without the other.
Yes.
Then you're not going to win.
Yeah.
And let's decrease the progression of diabetes so we can prevent some of those complications.
Yes.
And thank you so much.
Yeah, and if you guys have any other questions on diabetes, just leave it in our comment section and we will definitely get back to you, answer all your questions.
Yeah, there's a lot to cover.
Yeah.
And we do also cover some of these topics in a bit more detail in some of our shorts on Instagram and TikTok. So also follow us there, leave comments, and
Enjoy.
Thank you. It was lovely.
It was so good.
See you.
Bye.
Bye.